Hello and welcome to MK's Exam Secrets. My name is Dr. Moses Kazevu, Season 1, Episode 3. This is a series on my YouTube channel where we'll look at 6 exam questions in one clinical course. And today we're going to be looking at pediatrics. If you haven't yet subscribed to the channel, please hit the subscribe button, hit the bell notification icon to be receiving notifications every time I post such videos. Drop a like, drop a comment, and share the link so that you help me out with the YouTube algorithm, of course. So grab your piece of paper, your pen, and let's go. So question 1, Wamunyima, who is a 7-year-old, referred to the Children's Hospital University Teaching Hospital from Usakila Hospital for further management. She presents with 3-month history of ill health with complaints of generalized body aches, tiredness, and gum bleeding. She also has lost a lot of weight. Her FBC is as follows: hemoglobin 5.2 grams per deciliter, platelets 26, neutrophils count 0.5, and peripheral smear shows numerous lymphoblasts. So what is the most likely diagnosis? So I'll give you some time to absorb this question and think about it. And if you like such of these videos, please let me know in the comment section below so that we can keep making more of these in the coming days. So this is a 7-year-old child that has presented to the hospital, and they're having this 3-month history of generalized body aches. They are having some tenderness, they are having some bleeding from the gums, and they have lost a significant amount of weight. And if we look at the HB, this person has a low HB. The platelets are pretty much low, neutrophils are also low, but they have numerous lymphoblasts that are happening. So you get someone who's having significant weight loss. That's the first thing. And the tiredness could be explained by the hemoglobin being low. The bleeding from the gums could be explained by the platelet count being low. The weight loss could be explained by the chronic illness. And of course, if you see these lymphoblasts, which are immature white blood cells on peripheral smear, it means that there's something wrong with the bone marrow, the functioning of the bone marrow. It could be an inherent problem with the bone marrow or the cells themselves. So most likely this child has what is known as an acute lymphoblastic leukemia, which is obviously a cancer, which explains the weight loss. So what physical features may you find on physical examination? Give at least 4. So here you could actually pretty much go to town. So these leukemic cells often tend to infiltrate certain organs, so that's where you may get this physical finding. So you may get that the patient has hepatomegaly, you may get that this child has splenomegaly, there may be lymphadenopathy, there may be skin nodules that may be there, they may have some cranial nerve palsies which you may be able to detect on your physical examination, they may have papilloedema, and last but not least, they may have gum hypertrophy. So why is Wamunyima bleeding from the gums and experiencing bone pains? So remember that in leukemias, you get this proliferation of immature blast cells and the lymphocytic progenitor cells in this case. And this is happening in the bone marrow, where almost all the cells that are being synthesized are blast cells, lymphoblastic cells. So these are going to crowd out the bone marrow, quote unquote, crowd out the bone marrow. And once the bone marrow has been crowded out, it decreases the synthetic ability to synthesize other cells. So it means that red blood cells are not going to be synthesized in large amounts, which explains the anemia. It means that white blood cells are not going to be synthesized in the normal amounts, which explains the neutrophil count, which is low. It explains platelets not being synthesized in the right amounts, and this leads to the thrombocytopenia. So most obviously that this person has a thrombocytopenia, and this is obviously a cause of a primary bleeding disorder, and that's why this girl is bleeding from the gums. And the reason why she's experiencing bone pains is that there is some bone marrow expansion that's going to be there, and this bone marrow expansion is going to lead to accumulation of these abnormal white blood cells. And of course, the pain may be sharp, sometimes it may be dull, and most often the long bones of the arm and the legs are the most commonly affected sites. So I hope you understand that question. Moving on to question 2, COVID-19 is predominantly more prevalent among adults, and the proportion of confirmed cases amongst children is relatively small. However, in recent months, with new variants of the disease developing, this has become more important in children. What does the abbreviation SARS-CoV-2 stand for? So remember that SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. So this is what SARS-CoV-2 stands for, and this is the causative agent for COVID-19. So name 3 conditions that may predispose a child to developing COVID-19. So one condition could be malnutrition. Remember that in malnutrition, you have low proteins in the body. And remember, antibodies are proteins. Complement factors are proteins. These intercellular mediators, which we call cytokines, some of them are proteins. So if you have a deficiency in proteins, the immune system is not functioning so well. So this may predispose the child to contracting COVID. Then the second thing is HIV infection, which is a cause of immunosuppression. The child could have an acute leukemia, like in the previous question, that may predispose to infections because their white blood cells are low and they are not functioning so well. Then Part C, name the 5 golden rules that the Ministry of Health Zambia has prescribed that everyone must follow in order to reduce the transmission of the pandemic. So the first thing is that mask up in public places. So wherever you are in the public place, please wear a mask. Number 2, maintain physical distance. So this is social distancing. So they should be at least a meter apart from one another, or at least 1.5 meters apart. Number 3, wash your hands frequently and or use hand sanitizer. You could use both. You could wash your hands and use the hand sanitizer. But when you wash your hands, which is much more superior to you using hand sanitizer, make sure you do it in the right way and with at least soap. Number 4, avoid any crowded places and at all costs stay home. And do not go to any parties, do not go to any gatherings, so stay home. And if you know someone who's infected, tell them to stay home. Then number 5, if you're infected, seek medical attention early if you're symptomatic. So there's a COVID line that you can call and inform, or you could actually go to the hospital and get help. Question 3. So Mwansa is a 7-month-old infant with 5-day history of diarrhea. Take a relevant history. I usually love these questions where they ask you to take relevant histories because they are the most practical kind of questions. You can think of it like you just received a child that's having this 5-day history of diarrhea, and you're the intern that's working there and you're supposed to take the history. So what questions are you going to ask in order for you to arrive at a diagnosis and not really waste this child's time by asking a lot of unnecessary questions? So the first thing that you would ask is this the first episode that this is happening? Because sometimes this child could be having these frequent bouts of diarrhea, meaning that you could underlie a certain problem. It could be that maybe this child isn't being fed right. Maybe there is an underlying immunodeficiency that may be there. The second thing that you want to ask is the nature and the frequency of the stool per day. So the frequency of the stool per day, if this child is having maybe 6 or 7 bouts of diarrhea in a day, then you know that they are losing a lot of water. But if it's maybe 1 or 2, they won't lose as much water. The third thing is the nature of the stool. Like I said, is it semi-solid? Is it completely liquid? And the consistency of the stool. So is there any blood? Consistency and contents. Is there any blood in the stool? Is there any mucus in the stool? Because all these things, is it watery? Because all these things mean a certain thing. If you get blood in the stool, there are certain causes that cause bloody diarrhea in children. If there's no blood or watery type of diarrhea, there are certain causes that result in watery type of diarrhea. The fifth thing that you're going to be asking about is associated vomiting. Is there any associated vomiting? And if the vomiting is present, what's the nature of the vomitus? What's the amount of the vomitus? And how frequent has it been happening? Is there any associated abdominal distension? It's very difficult to determine whether a 7-month-old child would have abdominal pains. So maybe excessive crying from the child, especially when palpating the abdomen or touching the abdomen. You ask if there is a presence of a fever, which may suggest an infectious cause being as a result of the diarrhea. Ask about the nutritional history. If the child is taking water, what's the source of the water? Okay, is it boiled water? Is it tap water? Is this child breastfeeding? Remember that breastfeeding not only protects the child from upper respiratory tract infections, but it also protects the child from gastrointestinal infections. Then is this child on formula milk? If this child is on formula milk, how is the formula milk made? Because sometimes a child can be given too dilute of a formula milk or too concentrated of a formula milk. So whichever case it may be, it may result in diarrhea in the child. Then, of course, is the child exposed to HIV or not? If they are exposed to HIV, are they on any prophylaxis or any medication at all? Are they taking any other medication? Because certain drugs may induce diarrhea. And then, of course, have they received any vaccines, especially for rotavirus, that may cause diarrhea? So those are the important questions that you would ask on a child that's presenting to you with a 5-day history of diarrhea. So question 4. Kasongo, a 5-year-old boy from Chingwele, presents with a mandibular mass causing dental malalignment. Histopathology results reveal a starry sky appearance. What is the most likely diagnosis? Write down investigations you would carry out prior to chemotherapy. Mention 2 crucial measures you would take prior to and during chemotherapy. Write down the most common complication related to chemotherapy of this condition. Give at least 3 biochemical derangements associated with this complication. So this is a pretty straightforward question. They've already given you the diagnosis in the question. So it's a starry sky appearance. You only see that in Burkitt's lymphoma. So most obviously, this child has a Burkitt's lymphoma. Now, the investigations that we often order for prior to chemotherapy, we want to ensure that you get a full blood count. You want to get liver function tests because these drugs obviously some of them are hepatotoxic that may be used in the process of treatment. You want to order for urea and creatinine. You want to do a cross match or a group and save. You also want to order for serum electrolytes. Those are the 5 things that you would do. And then mention 2 crucial measures you would take prior to and during chemotherapy. So before they actually start chemotherapy, there's something that we call pre-rehydration. So you make sure that this child is rehydrated prior to them giving chemotherapy because of the complication that I shall mention in the next question. You also want to give them allopurinol. So allopurinol is going to prevent exacerbation of gout because you have a lot of uric acid that's being formed because the chemotherapeutic agents that you're giving to this child are killing cells. And once the cells are being killed, they're releasing that uric acid, and the uric acid formation is going to may exacerbate gout among many other things that uric acid accumulation can lead to. So write down the most common complication related to chemotherapy of this condition. So it's tumor lysis syndrome. Because you give this chemotherapy, it's killing a lot of cells, and the cells are releasing all their content into the blood. So there are certain derangements that may be seen biochemically. Things like hypokalemia, you may have hyperuricemia, you may have hyperkalemia, and of course hyperphosphatemia. Those are the biological derangements that may be seen. Then question 5. Malimu, a well-nourished 3-year-old, is failing to stand as he wakes the morning from bed. He has no fever, and his diaper is dry despite having been given his milk in the late hours of the night. He has a bout of diarrhea 3 weeks ago. On examination, his bladder is distended and the Babinski is absent. Question A. Which CNS pathway is affected? B. Write down your differential diagnosis. C. Give your most likely diagnosis. D. Write down 1 pathognomic investigative finding. And E. List down 2 possible causative agents. So this is a child that has woken up and all of a sudden they can't walk. Okay? And they have had a history of having this GIT diarrhea. That's very significant for you to note. And this child has been fed the prior night, so you expect them to have at least some poop in the diaper, but it's dry. So it means that there is some ileus that may be there, paralysis of the gut. So part A, which CNS pathway is affected? So most likely, this is a motor pathway, a descending motor pathway is going to be affected, because remember that you have 2 predominant pathways, the sensory pathway and a motor pathway. And the fact that this started with the motor presentation is also going to help you now with your most likely diagnosis, or what's going to be pointing you towards your diagnosis. And remember, also keep in mind that this child hasn't had a fever, because that would obviously mean a different thing if a fever was present. So write down your differential diagnosis. So this child could have Guillain-Barré syndrome. They could have poliomyelitis. They could have transverse mellitus. Then give your most likely diagnosis, so it's Guillain-Barré syndrome, GBS. So most likely this happened after this post-gastroenteritis that may have been there. And most commonly we do see this in children that have a viral infection of the gut. Sometimes it could even be an upper respiratory tract infection. Sometimes in even rare conditions, it could be after the child has gotten a flu vaccine. Then write down one pathognomic investigative finding. So usually we do nerve conduction studies, and it shows that there is a slowed conduction. In about 95% of the time, it is sensitive for you to actually make a diagnosis of GBS. Then list down 2 possible causative agents. So they could be upper respiratory tract things like cytomegalovirus, Epstein-Barr virus, even mycoplasma. It could be gastroenteritis that is often due to Campylobacter jejuni, and some rare causes include things like HIV seroconversion as well as flu vaccines. So the last question, and if you're enjoying these videos, please smash that like button. Let's go as high as possible. So Musonda is a 10-month-old infant brought to the emergency room on account of excessive crying. You note that Musonda's fingers are swollen and tender, and the sclera of her eyes have a yellowish tinge. What is Musonda's most likely diagnosis that explains both her swollen fingers and the jaundice? What 4 questions are you going to ask in order for you to establish a diagnosis? What 3 investigations will you do to establish your diagnosis? Name 1 musculoskeletal long-term complication Musonda may have in the future if nothing is done about her condition. So most likely, the thing that would explain the swollen fingers and the jaundice, the only thing that comes to my mind is sickle cell anemia. Let me explain. So remember that in sickle cell anemia, you have those crises that we talked about. The sequestrative crisis, the hyperhemolytic crisis, the aplastic crisis, the vaso-occlusive crisis, and of course they could be mixed. So the hyperhemolytic crisis may explain the jaundice because you are breaking down more red blood cells than usual. Remember that the hemoglobin is metabolized and eventually forms bilirubin, which may be in excess amounts and begin to deposit in the sclera and the tissues. The swollen fingers could be obviously due to dactylitis, acute dactylitis, which is a vaso-occlusive crisis that's affecting the wrists and the fingers. This is actually the most common presentation in young individuals, in infants. So most likely this person has sickle cell anemia. And what 4 questions are you going to ask? The first thing that I'm going to ask is about the recurrency of the symptoms. So how many prior admissions has she had? Or he or she, I don't know if this is a female or male. It's a female. So how many prior admissions has she had? This will give you an indication that this has been there for some time. So usually these people come in with multiple admissions. Then, is there any personal or family history of sickle cell? Has this child been found with sickle cell before? Or does anyone in the family have sickle cell? Then number 3, is there any history of blood transfusion? Has she received any blood transfusions? If she has, how many has she received and when did she receive them? And then is there any history of infections, especially chest symptoms? So anything like coughs, anything like difficulties in breathing, is there any GIT infections, recurrent diarrhea? Sometimes they could even present you with constipation. So those are the 4 questions that you would ask in order to make a diagnosis. Then what 3 investigations will you do to establish a diagnosis? So you can order for a full blood count or serum bilirubin in this case, whichever investigation you pick. But of course your full blood count may show that there's a raised white blood cell count. You may see an increase in RDW, that's the red distribution width. Then you obviously also do a peripheral smear where you're going to be seeing the sickle-shaped red blood cells. You may see target cells. You may also see Howell Jolly bodies. If you have no idea what I'm talking about, please go to the playlist and watch the video on sickle cell because you clearly need some revision. Then the last test that you could do is a sickling test or an HB electrophoresis. Remember, HB electrophoresis is the gold standard for diagnosis of sickle cell. Then name 1 musculoskeletal long-term complication Musonda may have in the future if nothing is done about her condition. So she may have growth and developmental delay. She may have avascular necrosis of the head of the femur, even the head of the humerus. She may also have compression of the vertebra. So just pick one and put it there. So thank you for taking your time to power through this episode of MK's Exam Secrets. If you still haven't yet subscribed, I don't know how many times I'm going to say this. Please subscribe. hit the bell notification icon to be receiving notifications every time I post. Hit the like button, drop a comment,